So next step is just being aware of some of the other manifestations of this disease, and we've talked about jaundice, so the way we intervene with that is put in a stent or a little metal tube into the bile duct. That's done pretty readily as an outpatient procedure via something called an ERCP. Infections can be a common consequence both of disease and treatment, and in particular for individuals who have stents, these stents can get clogged, bacteria can get into the bloodstream, and an individual can develop something called cholangitis, which requires antibiotics and often an exchange of that stent. Blood clots are common, and nearly half of patients over the course of their disease may develop a blood clot. That can be in the leg, a DVT, or in the lung. That's called a pulmonary embolus. And important to know that these are treatable. While they're a little bit of a scary thought, they are treatable, and they're effective medications with either injections, low molecular weight heparins, or now a new class of oral agents that we use on a regular basis. Lack of energy and fatigue is a very common issue with this disease and treatment, and I would say we try to address this as effectively as we can, and there are a number of strategies there. So for example, if a person's becoming anemic, the red cell count is going down, we'll try to keep that higher. Sometimes dose adjustments of the medication. Sometimes the energy impact can come from narcotics and medication used to treat pain, so being attentive to those or using alternative strategies can be helpful. Managing glucose and making sure that for people who are diabetic or have a pre-diabetic state, that their glucose is well controlled is important. Uncontrolled blood sugar can lead to an increased risk of infection and sometimes weight loss and overall malaise. And importantly, we always tell people not to be brave, right? The healthcare team is here to help and to try to effectively address symptoms and side effects. And your healthcare team is a wonderful resource, and in particular, and I'll put in a plug for our lovely colleagues in Christie in terms of nursing and nurse practitioners who do an absolutely terrific job and spend a lot of time walking patients and families through helping symptoms. And maybe I'll ask you here, and if you want to add to this.
Yes, no, definitely. The first thing, like you said, we want you to know is that if something is going on, there's a change, we want to know about it. You're not burdening us. We want to know as soon as possible so we can help you and so that you can maximize the treatment, or if we need to decrease a dose, we're aware and we can, get things going immediately. And so don't suffer in silence. We're here for you to help. There's a lot of resources in the office, and like you were saying, on a daily basis, the nurses are just triaging and are very used to these complaints. And we're here for you.